So I wanted to ask about this concept of patient-centered cancer care. And of course, you and I and Joel and some others here at Penn State have gone to this conference the past couple of years where that's been the theme of, patient-centered cancer care. And in some ways, it's sort of shocking with why wouldn't cancer care be patient-centered? But, as you listen to patients and listen to some of the challenges that they have, there are many who feel that there are improvements that can be made. So I was wondering your thoughts on this topic.
Yeah, so the challenge with for a patient who has cancer is that there are lots of different options out there for that they can choose from or that can be recommended to them. And so, think about it almost, as being hungry and going through a supermarket in a foreign country or in another society that has nothing understandable on the label. You can't tell and you don't know what it looks like, and they're just boxes of things, and you've got to choose them. And so what it amounts to is that the consumer, the patient with cancer, is really very highly dependent upon their provider for recommending and giving one or another therapy. Mm-hmm. But if you take it a step further, there are many different types of providers. And so it's the medical oncologists, the surgical oncologists, the radiation oncologists, and there are many individuals that will have differing opinions. And for the patient, it's sometimes very challenging to, number one, have everybody on the same page, and number two, think that, or at least hopefully feel confident that everybody's talking to each other and is working out the best plan for them. We see this on some of the advertisements on TV from some institutions that are really saying, really emphasizing that everybody works together. The reality of it is that in oncology, we've done that for years, but we've really not made it very clear, as clear as we should, to patients that that's exactly what we do. Mm-hmm. So we work really hard, we work closely with our colleagues, and the patient-centered aspect of it is that we as healthcare professionals are all working to really come up with the best plan for the patient. Now that's just the medical part of it. Now you get into the other layers. So this medical therapies we offer, well, depending upon the person's insurance or payer, one may be a preferred treatment versus another one. There may be large differences in out-of-pocket costs for the patient depending upon one approach versus another. And so that's yet another layer that the patient has to choose from. And so the thinking is with patient-centered care is all of that kind of comes together around the patient where they can make, the best informed decision, for themselves and for their situation as to what approach they'd like to take. And probably the best way to deal with that is, as you may be aware of, this notion of patient navigators that we have. And at the Penn State Medical School, we have a program whereby we have medical students in their first and second years that actually serve as patient navigators. They hook up with the patient early on, and as they themselves are learning what the healthcare system has to offer, they're kind of holding the hand of the patient going through it to really make it so that we're more user friendly, I guess.
Yeah, that seems like a great model to me because, so many new med students who are students in residency are fairly young and haven't always experienced, unless through their family, they've experienced medical situations. And so actually sort of seeing things through the eyes of the patient, and in this case, helping them navigate the system can be valuable. Another term that's often used is shared decision making. And as I've heard cancer patients talk about it, sometimes in certain types of treatment, there are trade-offs between quality of life and longevity of life. And I guess that's another area, too, where the patient-centeredness comes into play, is helping patients make that trade-off when, in fact, for their type of cancer that might exist.
Yeah, and that's absolutely correct. I mean, there have been studies out there that you're well familiar with, where at least for cancer patients, we have to ask ourselves some questions about, how hard we push and how many options patients will seek to have. And so there, a disproportionately large fraction of the healthcare costs that we deliver to our patients frequently occurs in the last couple of weeks of their life, and that really those interventions and those very costly interventions are frequently started at a point where there now is increasingly a larger percent of caregivers that are concerned that there may be futility involved in offering those approaches. And the challenge is really starting with having patients understand early on, number one, we're all going to die of something, and we can't. Nobody is going to be able to live forever, and that they're depending upon the cancer, depending upon the therapies that we offer. They're going to begin to be trade-offs. Early on, there's no question, but later on, there are trade-offs, and then every patient individually, as we all do, have different tolerance for adversity and for inconvenience and for sickness, if you will. And so, what you might put up with versus what I would put up might be different. And what we need to do is as providers, and not just as physician providers, but as healthcare providers, is understand that there are differences and really try to respect that, and continue to have the patient be the decision maker, but make sure that those decisions are as well informed as they possibly can be.
So really a team care model is probably needed. There's a lot that we expect of clinicians and a lot of work to be done. So patient navigators, clinicians, students, financial counselors, really connecting with primary care and other family providers. Really, it seems like a team-based model is where this
absolutely. And for my world, so where what I do is deliver chemotherapy drugs more often than not. The easiest part of my day, quite frankly, is writing that chemotherapy drug and having it go. The hardest part is really getting the patient and everybody else coordinated around that decision that's been made, and looking out for what's going to happen from the treatment, what are the unexpected consequences, what's the impact going to be on the patient financially and socially, and we as physicians never used to pay attention to that, and in fact there were many that felt we should never even think about it, but I'm of the mindset, you bet we need to think about it, and we have to pay attention to what that individual patient, what we're offering, how it impacts on their life, and kind of help them work through the decisions. The problem is that takes time, and the more time any one provider or group of providers focuses on a patient, the more costly it potentially becomes. Unless we figure out a way to wrap it all together.
Right.